to log back in.
Okay, we'll give them a second. Paola, could you send a quick text
Yep.
to somebody there?
Yep, on it.
Loretta, it's Kara. We're just having a bit of issues on our end with the feed, so we're just going to log out and log back in, and the Premier should be here in 1 minute.
Okay, thank you.
Ontario doing a final sound check.
Yes, we can hear you. Thank you.
Thank you.
Recording stopped.
Loretta, this is Paola. I'm just letting you know that I've got news from Premier Stephenson's team. They have left the meeting once again. They're going to try and log in once again.
Okay, and I've just admitted them.
Okay, excellent.
Recording in progress.
So just to report to Premier Stephenson. Oh, great. We're seeing you now, Premier Stephenson. Great. Could we do a quick sound check with you?
Okay, can you hear me now?
Yes, I can. Thank you. That's great.
Loretta, are we
sorry, can I just jump in here?
Please go ahead, Jamie.
Premier Stephenson, can you just do another test for us, please? I heard Loretta's voice in the background of your feed.
Just testing 1, 2, 3, 4.
Test 1, 2. Okay.
Can you hear me?
We can hear you. Yes. Thank you.
Okay. Turn these around. Okay.
Loretta, this is Paola. Can we give the signal to start the 2-minute countdown?
Yes.
Excellent.
Hang on, I'm hearing that echo again. Premier Stephenson, can you mute your mic, please? And then Paola, can you talk again, please?
Okay. We are just getting ready to start the 2-minute countdown to get the meeting underway.
Premier Stephenson, can you unmute your mic again? And Paola, can you talk at the same time as well, please?
Hello?
Again, we're just trying to get things sorted out so that we can do the 2-minute countdown. I do hear the echo.
There's an echo coming from Premier Stephenson's setup somewhere.
So we're unmuted because that's what you asked us. Do you want us to mute it again?
Yes, but if somebody else is speaking, it's coming back into the room and your microphone is picking it up.
Okay.
So it just will need to be managed very carefully on your end. I'm not sure what the setup is there. If you've got a speaker that's maybe too loud, but it's the microphone is picking it back up.
I can't hear anything now, so I don't know. Okay.
All right, so shall we start the 2-minute countdown?
Yes. Oh, sorry.
Jamie, yes?
Yeah, we're just waiting to ensure that Premier Stephenson is all good, and then we can start the 2-minute.
Okay.
Hi, everyone. This is the 2-minute warning. We'll begin in 2 minutes. Please make sure you're on mute and do not turn off your cameras until the conference ends today. Thank you. Seconds. Ten seconds. Good. Oh, I'm going to start. Sorry, Premier. Good afternoon, everyone. Thank you for joining today's news conference. We will start off today with remarks from the Council of Federation Chair, Premier John Horgan, followed by remarks in French by Premier of Quebec, Francois Legault. We will then take questions from media on the line. As a reminder to media, you may press *1 at any time to join the queue to ask your question. You will be limited to one question only. It is now my pleasure to introduce the Premier of British Columbia, John Horgan.
Thank you, Lindsay, and good afternoon, everyone. I am coming to you today from the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. We have just finished yet another meeting of the Council of Federation. By my count, we have had over 40 meetings in the past 2 years, dealing mostly with the pandemic, but also bringing together views and values from across the country, different political perspectives, different regional needs, territories and provinces coming together to talk about how we can ensure that we're providing the best possible services for all Canadians. And of course, the global pandemic has tested us all. It has strained our public health care systems right across the country. And all 13 premiers agree we need a significant long-term increase in funding from the federal government to meet the challenges of coming out of the pandemic and ensuring that the services that people expect and deserve in Canada are uniform from coast to coast to coast. We need to work on a pathway to come together on a First Minister's meeting to increase the Canada Health transfer That has been the focus of the premiers for over 2 years now, and it's an urgent need. It holds true whether you are facing a global pandemic or not. It holds true now more than ever because we know as premiers that we need to be accountable for the services we provide, and we need to do that in a way that meets the requirements of the Canada Health Act. When our partnership for healthcare, public healthcare in Canada began, it was more or less a 50-50 proposition. But over the past 50 years, we've seen an erosion of federal funding to the point now where it is, in some cases, only 22% of the total funding needed to provide services. That means the provinces are picking up the rest of that funding, and that is not sustainable. We all agree we need a rebalancing of funding to ensure that we can provide the services that people depend upon. The past 2 years have been challenging for all of us, and people from different political stripes have approached this in different ways. But as premiers, over these past 2 years, we have focused on seeing the increase in funding from Ottawa go from the 22% it is now up to 35%, so that we can meet the challenges coming out of the pandemic and, of course, the demands and expectations of our citizens wherever they may be. And I appreciate that some people, when they hear Canada Health Transfer, start to glaze over. This is an accounting process. This is about one group asking for something that others have not yet had. This is about providing services for people. It's about wait times. It's about human resources in our healthcare system. It's about making sure that we can provide state-of-the-art diagnostics so that we can address diseases as they come forward, like COVID-19, like cancers. And I want to pause for a moment. Many of you will know that I've recently experienced my own cancer story, the second time in my life. And from the beginning of my journey over the past number of months, I've been struck by the kindness and the professionalism of healthcare providers, whether it be at the admissions desk at the hospital, the pre-op care, the post-op care, right up to the point where I rang the bell at the end of my cancer treatments, that there were people that were there to do these jobs day in and day out, week after week, year after year. Pandemic or no pandemic, those healthcare professionals provide a quality service that is not sustainable in its current model. I saw that on the faces of nurses, on doctors, healthcare providers, care aides. We need help to be coming on the horizon, and we need it in the form of more funding from the federal government. All of us agree on that, and all of us are focused on that. We had a very productive discussion today, an hour and a half of engagement across the country from coast to coast to coast, large provinces, small provinces, territories, all focused on getting better outcomes for Canadians. We've seen that we can do that. Case in point would be childcare funding in almost every province, working with the federal government to provide services for people. Through the pandemic, the federal government has been an outstanding partner, ensuring that we're supporting businesses, workers, and communities so we can all weather COVID-19. And now provinces and territories are coming together once again to call on the federal government to join with us and renew the partnership for public health care in Canada. It is as Canadian as hockey. It separates us from our neighbours to the south. Public health care is precious to us all, but it needs to be nurtured, it needs to be stewarded, and it needs an influx of cash from Ottawa, not as money that is Ottawa's, but money that is Canadians. We send our tax dollars to Ottawa, wherever we might live, and we need to find a way to reallocate those to meet this biggest challenge that we have faced in the delivery of services. I'm proud of the work that we've done in British Columbia, and I know each Premier has got something to say about how we've addressed COVID-19. We also had a discussion today, and there will be an opportunity to talk about that, about the challenges and the strain that is very much on the faces of Canadians wherever they may live. Almost all of us have seen a 90% uptake on the implementation of vaccines. The people of Canada have stepped up and done what's been asked of them, but we're growing weary, all of us. Whether we are in public life, whether we're public health officers, whether we're regular citizens, we all want to put COVID behind us. But we need to make sure we hold the line and get to that place where we can be as safe as possible. And we need to make sure that there are dollars there to provide the health services that we all depend on. And with that, I'll pass it back to Lindsay and Premier Legault to make his comments en français.
Thank you, Premier. We will now hear from Premier of Quebec, François Legault. Please go ahead, Premier. Self from mute. Still muted. Just give us a moment. Premier, is there someone there that can help you unmute?
Est-ce que ça fonctionne?
Is it working now? Can you
Go
hear
ahead.
me now? All right, great. Okay, no, it's fine, Mark. Okay, so I'm sorry about that. I would like to first of all say hello to everyone, and in particular to my colleagues, the premiers of the provinces and territories. And I would also like to say that I'm very happy and very proud to be able to see that the premiers of all 10 provinces and 3 territories are united. So we are making a request that is unanimous. A request from the federal government. We quickly, urgently need better funding for our healthcare networks. We already had a problem even before the pandemic hit. And now with the pandemic, what we've realized is that we had to have even more hospital capacity in order to be able to treat COVID patients, but also continue giving services to patients that I would call regular patients. And the problem comes from the fact, quite simply, that right now, the federal government funds 22% of health expenses in Canada, whereas the provinces, the provincial governments and territorial governments finance 78%. And health is the only expense that is increasing of about 5 to 6% per year. Why? Well, amongst other reasons, because the population is getting older, since we have every year older people who on average do need more health care. So the needs increase by 6% per year. So a great deal more than any other expense and a great deal more than the income of governments as well. So it is important. If I look, for example, in Quebec, Quebecers have about 40% of their taxes. They sent about 40% to Ottawa and 60% in Quebec. So it's not normal that the federal government only finances 22%, whereas the provincial government finances 78%. So what we are asking all 13 provinces and territories together is to change that ratio from 22.78 to 35.65 in order to be able to continue. And it's important to say that in the past 2 years, the federal government has helped us financially in order to be able to get through this pandemic. But the amounts that we received were non-recurrent amounts. That is to say, amounts that we won't be getting in the upcoming years. And of course, the most significant expenses in health are wages, to be able to employ nurses and other staff members. Those expenses are going to continue once the pandemic is over. So what we're asking from the federal government is to increase the funding from 22% to 35%. It's a significant increase of $28 billion per year for the federal government, but it is absolutely necessary in order to fund our healthcare networks correctly, because this is a priority everywhere in Canada. So we ask the federal government to meet with us, finally, and to sit down and talk with us about how we could increase the funding of the federal government and make it go from 22% of expenses of the government to 35% of the healthcare expenses. And we ask that those transfers be made without any conditions, because it is the provinces and territories who best know where to invest and what the priorities are. So, Mr. Trudeau, please, let's have a seat together in order to be able to increase the percentage of health expenses that are funded by the federal government. I think that this is a request that comes not only from all 13 territories and provinces, but from all Canadians. Thank you so much, everyone.
Oh, we will now take questions from media on the phone line. When called upon, I ask that you please state your name, your outlet, and direct your question to one premier. I would also ask that you please make sure your phone is not on mute. You will not be audible until your name is called. Today's first question is from Justine Hunter, Global Mail, BC.
Hi, thank you to Premier Horgan. Canada's healthcare unions and other groups want Ottawa to increase healthcare funding as well, but they say it should not be unconditional. They think Ottawa should insist on strong national standards. Are they wrong?
Well, I think the issue for us is that we are accountable to citizens in our various jurisdictions. We need to ensure that we have predictable, sustainable funding to meet the challenges of our changing communities. And what we're responsible for is the delivering the services. Obviously, the federal government has a role to play in what those standards would be. But the needs in New Brunswick are not the same as the needs in Saskatchewan. And our concern about tying strings to funding is that it will be focused on what might be the issue of the day rather than the long-term sustainability of our system, whether it be long-term care, reducing surgery wait times, the human resource issues, hiring more people, making sure they're appropriately compensated. There's a myriad of issues that we need to address as we deliver these services. And we also, I have to say, we do that by consulting with the workforce, the unions that you reference. And it's our objective to make sure that we're delivering the services that people need in a timely way, and that by and large, the delivery of those services are uniform from coast to coast to coast. But the nuances are in what is the most important part in every community, and that changes based on the lack of funding. Makes us, if I can use the term, triage those resources to put onto the priorities that we have in our individual communities, and that changes from province to province. So when you have conditions on funding, that restricts and inhibits your ability to focus on the needs in our various jurisdictions. And that's why we feel so strongly about this. This isn't about not being accountable, far from it. We're accountable every day in our legislatures, through our budgeting process, through our public accounts process, through various other reporting relationships we have with our health authorities. So I think to say that if Ottawa is dictating how we do this, it'll somehow be better. We all work together to find the best way forward, and that collaboration is what got us to this table and got us to this point, quite frankly. We've been working with Ottawa. We've been working together to find the best way to deliver for people, and that's our commitment, and that includes making sure we listen to voices wherever they may be.
Next question is from Ryan Kessler, Global News, Saskatchewan.
Good afternoon. My question is for Premier Scott Moe. Premier Moe, as you are no doubt aware, there's a trucker convoy planning to surround the legislature in Regina. It's already caused it to close to the public. Yesterday, the leader of the opposition called on you to show leadership and denounce this. So I guess my question to you is, will you condemn the trucker protest planned for this weekend in Regina?
I would say, and we had a discussion on a number of the protests across Canada, and a couple of my colleagues might weigh in on this as well. We most certainly agree that, all Canadians do have the right to protest. However, they do have that right to protest peacefully and within the confines of the law that we have. We also had a broad discussion here today around, what ultimately is many of these current protests here today, and it is, as Premier Horgan had mentioned, folks across Canada are growing weary. They're growing weary of, managing their way through COVID in their personal life, in their professional life, and they're growing weary, quite frankly, at times as well, of a number of the public health measures that have been in place for a period of time. And I thought Dr. Tam had addressed it quite well today. That we all need to look at a sustainable approach to COVID-19 as we move forward, and most certainly that's what we're doing in Saskatchewan. We support everyone going out and getting vaccinated in our province, but we're also looking at our public health measures and the effectiveness of each of those public health measures, given that we have a number of additional tools that are available to us here today. So, all folks, whether it be today, whether it be a year ago, whether it be a year or two into the future, they most certainly have the right to protest and to have their voice heard. However, what I would say with respect to that is they most certainly should be doing so in a peaceful way, but need to be doing so within the confines of the laws that are there. To your comment around some of the area around the legislature in Saskatchewan being confined, I believe there's also a significant outdoor festival that they're looking at confining some of the area to pedestrian traffic so that people do have access to the Frost Festival in Regina as well. And Premier Horgan, there may be another colleague or two that might have a comment on this.
We did have a comprehensive discussion about these issues. I know different provinces are looking at this in different ways, but there was one common position, which is that we all strongly believe that our immunization programs have been successful to reduce transmission, reduce severity of Omicron, and so we're of one voice on that. With respect to how we'll deal with situations in our various communities, that's up to the tolerance, quite frankly, of the public. And the message was pretty clear. We hear the voices of disappointment, but we also want those voices to respect the rights and liberties of other people. And when your desire to have your voice be heard starts to interfere with the lives of other people, that's when lines are drawn. And I know that others have strong views on this. I don't know whether we should open it up, or I'm sure there will be other questions in this regard. If there's not, perhaps we can circle back to it.
We have a comment from Premier Stephenson. Please go ahead.
Thank you very much, Premier. And I just wanted to add, obviously, this is also happening at the legislature in Manitoba. And I just want to say, so far, I just got an update that things are going very peacefully. I know the Winnipeg Police Service is working very closely with those who were involved in the protest, and things are going well. Obviously, we want to encourage that to continue that way. And obviously, if things change and things start to deteriorate, we'll continue to monitor the situation and take action if needed. But we are working very closely with Mayor Brian Bowman. We had a good discussion on this morning, taking a collaborative approach to this, and so we'll continue to monitor it. So I just want to say to Winnipeggers, to Manitobans, that we're here to ensure that you can continue to flow, continue to go about your day-to-day life, and we'll continue to monitor the situation. We'll keep everyone apprised. Thank you.
Thank you, Premier. Next question is from Wayne Thibodeau, CBC PEI.
Good afternoon. This message is this question is for Prince Edward Island Premier Dennis King. Premier King, the National Healthcare Survey clearly pointed out that smaller provinces throughout Atlantic Canada are concerned that the healthcare system here, if it doesn't get an infusion in cash, will not be able to be on par with other provinces across Canada. I'm wondering how concerned you are about PEI's ability to maintain a level of service which is comparable to other provinces across the country.
Well, hi there, Wayne, and thanks for that question. This is obviously an issue that is of importance to all of us in smaller jurisdictions, whether the Northern Territories or some of the smaller provinces. What we know is that the cost of healthcare continues to increase, and in most provinces, it's increasing at a rate of 7-8% a year, and that needs to be met. That service needs to be offered. As Premier Horgan has said, that is what Canadians and Islanders expect, and that is what they should be able to be delivered for or to. We also have seen that the federal allotment in that hasn't kept up at that same pace. And that is why we need the federal government to come in with consistent long-term funding that will serve the smaller jurisdictions as well as the larger jurisdictions in the country. We will provide that service. Each province will provide that service. But if we're not getting a fair and equitable long-term provision of funds from the federal government, it will mean we will not be able to continue to offer other programs as well, and it will continue to hamper us as we try to deliver a top quality healthcare service for Islanders. As a small jurisdiction, it's difficult at the best of times. We don't have a full fleet of services and specialties. We have to rely on our friends in Nova Scotia and New Brunswick, for example, for some of our services. And that is why we need the federal government to step up, and we're united here at this table to get that commitment. We feel we're on a good path here, but I think the ball's in the federal government's court right now, and we need them to get down to business.
Thank you, Premier. Next question is from Turia Isri, CTV, Edmonton.
Good afternoon. This question is for Premier Jason Kenney. It's about comments that you made last night in your Facebook Live about possibly amending the Municipal Government Act so that municipalities can't bring in public health restrictions if the province does decide to fully lift them. You had suggested that municipalities don't have access to the same data that the province does, which is guiding you when it comes to making these decisions. So why not provide municipalities with this data, since they are also on the front lines of the pandemic?
Thanks very much. First of all, healthcare, of course, is a provincial responsibility under the Canadian Constitution. While we do need federal funding to help make it happen, and that's why we're calling on the federal government today to pay its fair share of healthcare costs. But healthcare is not a municipal responsibility, and public health, of course, is under the Public Health Act as well a provincial responsibility. So the provinces are in the clearly the best position to make difficult decisions about how to manage COVID-19, and I really don't think that is something municipal governments are responsible for or necessarily equipped to do. I also think that having completely different policy settings across the province simply creates greater confusion for the public. What Albertans want is clarity in terms of what the public health measures are, not to have those measures different depending on what side of a municipal boundary they happen to be in. So I would encourage municipal elected folks to respect the decisions that the province makes on public health matters and not to improvise public health policy. If they want to provide us with input, I'm always happy to take that on board. But at the end of the day, we all know now we have to learn to live with COVID, and we have to change, and our response to COVID has to change as the nature of the disease changes. To use exactly the same kind of tools that maybe were relevant 18 months ago as we go into with a population 90% first dose vaccination coverage, widespread immunity through prior infection, additional antiviral and other effective medications coming on stream, much greater knowledge about how to deal with the disease, and much better habits in terms of personal hygiene and health. So I think we are in a position to move forward as much of the rest of the world is doing, to reflect the lower severity of Omicron, the higher levels of vaccination and population protection, and that's what will inform decisions made by Alberta's COVID Cabinet Committee next week.
Thank you, Premier. Next question is from Emily Bergeron, CP, French, Quebec.
Oui, bonjour. Une question pour Monsieur Legault.
Question for Mr. Legault. We asked a moment ago about the convoys of truckers. How do you see this impasse that we see in Quebec, but we see also elsewhere? Do you have expectations towards RCMP or the federal government?
François.
OK, donc, ce que je disais, c'est que
what I was saying is that my responsibility is for Quebec. I'm Premier of Quebec. What I did is that I made sure with the Mayor of Quebec City, with the police of Quebec City, and with Sûreté du Québec, that we let people demonstrate the way they will, but it should not hamper normal life of citizens. Like you know, this weekend it's Quebec Carnival. People are there with their family. They hope to go participate in the carnival. There are people who hope to go to a restaurant. They miss the restaurant for a long time. So I do not want, and we will not tolerate that protesters keep citizens of Quebec City or tourists in Quebec City to have a normal life and to go in restaurants, in hotels, to have various activities. For the time being, it is peaceful, and we hope it will continue in the same fashion. If it is necessary to intervene, like I said, we made sure that we have a lot of towing trucks ready. If there are trucks that we have to move, we'll move them.
Thank you, Premier. Next question is from Dale Manudoc, CBC, Toronto.
Hi, this question is for Premier Ford. With this coming protest to Toronto tomorrow, you said God bless them and you understand their frustration. Previously, you called anti-lockdown protesters a bunch of yahoos. So What's changed?
Well, Dale, I think you're spinning my comments a little bit, but I will answer the question. I have all the confidence in the world. The Toronto police have it, this is in a good situation as of right now. Let's just hope it continues that way. And they have my support 100%. But I'll tell you one thing, Dale. Any harassment or acts of hatred or acts of violence, will have zero tolerance, absolutely zero tolerance. I reiterated my support to Mayor Watson, the Mayor of Ottawa, and Mayor Tory, that if they need any additional resources, we'll be there. There's one thing that all Ontarians have in common. They want to put an end to this. They want to move forward from the pandemic. Regarding Ottawa, the occupation, it's not a protest anymore. It's become an occupation, is only hurting families. It's hurting businesses that these folks are supposed to be supporting, but it's hurting businesses in a big way. People want to move on and to get through this. It's time for this to come to an end. And we're moving in the right direction. And, Dale, do you know what's a shame? Everyone worked so well together for 22 months, not just here in Ontario, across Canada. And, the public health measures are being lifted as we speak. We went for the first stage. We're going to the second stage shortly. There's one thing that brings everyone together, no matter if you're in Ontario or across Canada, is working together to get out of this. If you think myself or any of the premiers like this, you think we like lockdowns or public health measures, we don't. They were necessary. We're seeing the hospitals, have a lot more capacity as we move day by day by day. It's going in the right direction. So, call the protesters, the people that are occupying Ottawa, folks. Let's put an end to this. We're so close, so close to getting back to normal. We have to be united. We have to be united as Ontarians, as Canadians. And what's happening in Ottawa, my opinion, is unacceptable. As any premier would say, the right to protest, their civil liberties, the democracy, that's a given. But when you start occupying, it's unacceptable. And we won't have any tolerance. Again, I want to repeat this, for hatred of any kind, harassment of any kind, or violence of any kind. It won't be tolerated. Let's be united. Let's hang in there for the next little while. We will get through this.
Thank you, Premier. Next question is from Danton Unger, CTV, Winnipeg.
Good afternoon. This question is for Premier Stephenson. Premier, yesterday a memo was sent out to staff at the Manitoba Legislature building in preparation for the truck convoy protest today, asking or strongly encouraging staff to work remotely while the protest is going on. I'm just wondering if you can comment on this. How long are staff at the legislature being encouraged to work remotely?
Yeah, thanks very much for the question. And when we heard of the protests, obviously, first and foremost, we think about the safety of those working in the building, all staff in the building. And so we made that decision. The clerk of Executive Council, as well as the clerk of the Legislative Assembly, sent out a memo to staff asking them to stay at home. It's really for the safety of those employees. And so we'll, again, continue to monitor the progress of what happens during the protest. We'll ensure that it continues to go along the way it is right now. As far as I know, it is peaceful protest so far, and so we hope it continues along those lines and that we can get people back to work as soon as possible.
Thank you, Premier. Next question is from Juanita Mercer, St. John Telegram.
Thank you. This question is for Newfoundland Labrador Premier Fury. We have the highest per capita spending on healthcare in the country, the worst value for spending, and a significant doctor shortage. What difference will a 13% increase in federal funding mean for this province? And is that enough to fix our healthcare woes?
Oh, thanks for the question. And certainly no one understands how broken this system was before the pandemic than myself, who was on the front lines, and certainly appreciate the frustration of nurses, frontline healthcare workers, doctors, everyone who have survived through this pandemic and really done a hero's effort in keeping all Canadians safe. Newfoundland and Labrador, you're absolutely right, spends the most per capita on healthcare every single year, and yet we have some of the worst outcomes. We have demographic challenges that are complicating all of that. And that's why I think in moving forward with a collaborative approach of not just the collective premiers, but indeed the Federation and the country as a whole, we can provide better results across the country so that Canadians, no matter where they live across our great country, get the same access to quality of care. So an infusion of money is important, but as you've seen in our jurisdiction, we recognize that that's not the only solution. During this time of disruption, we have an equal opportunity to recreate and reimagine healthcare across our jurisdiction and across the country. And we here in Newfoundland and Labrador, as you may be aware, have launched a health accord to do exactly that. We know that there's an opportunity, a generational opportunity in front of us right now to capture on this time of disruption, utilizing tools that we have invented and used throughout the pandemic to change how we deliver care, especially in provinces like Newfoundland and Labrador that have a really low density across our beautiful landscape. And so, you know, the infusion of money is incredibly important, but how we use that responsibly so that we're delivering the quality of care is equally important. And we plan as a province to tackle that, tackle them both head on.
Premier, next question is from Laura Osmond, CP National.
Thanks so much for taking our questions. We've been hearing a similar call for more money into the Canada Healthcare transfers for a very long time now. You guys are in talks with the federal government more than ever during this pandemic. We have had a hard time getting any clarity about what the federal government's message is to you on all of this. Has there been any sign of or any indication of what the federal government is planning or when they are planning to have those conversations with you?
Well, I'm happy to take that question. Since I became chair of the Council of Federation, I've been working with the federal government. We've had, as many will know, an atmospheric river that led to extraordinary devastation of our highway system. Farmers in the Fraser Valley were inundated, an enormous burden after a year of historic wildfires and a global pandemic. And I have to say that my access to the federal government, whether it be through a joint committee we have between with our two governments to deal with the flood recovery, whether it be on wildfires, whether it be on the pandemic. As we all know, short-term, one-time funding for the challenges of 2020 and 2021 were readily available from the federal government. We're grateful for that. I believe we have a willing partner, but there has been a reluctance to engage in fixing the system until we came through the pandemic. But we're in year 2. Going into year 3, we're being junior year if we were at university. We need to get on this. We need to get on it now. We are one voice on that. I've been engaging with the Intergovernmental Affairs Minister, with the Minister of Finance, as well as the Prime Minister on this, and I'm confident that we have a way forward. We need to make sure that we get together in a room, all of us, in short order to address that. So we're calling again, as we have for some time. We need a First Minister's meeting dedicated to healthcare, dedicated to ensuring that the Canada Health transfer is integral to this. And I go back to my original comments. This isn't an accounting issue. It's not about us saying, give us more. It's about how do we deliver the services that the federal government knows Canadians need, that our provincial leaders all know our citizens need, in a way that they can restore confidence in a system that is straining at the edges. Premier Fury, as a physician, understands this full well. Me just coming through the many doors of the healthcare system, understand it full well. I'm confident that the unity that we've seen from 3 jurisdictions, different political perspectives, different regional needs, is unprecedented in Canadian history. And I know that the federal government understands that, and I'm hopeful that they will be in a position to bring us all together in very short order so we can address this for everybody.
Thank you, Premier. Our next question is from Richard Zussman, Global BC.
This is for Premier Horgan. Premier, have there been any discussions around a call from the premiers to the federal government around easing travel restrictions linked to the pandemic? There are a lot of families across this country trying to prepare for spring break. Right now, there's an advisory in place not to travel internationally. What is the stance from the premiers on whether these restrictions should be lifted and how soon, including the requirement around PCR testing to come back into the country?
I haven't had, I'm sorry. I was going to say I haven't had direct contact. I thought you were asking me. I was going to pass it over to Premier Horgan. Anyways, he's the chair and he'll answer for all the premiers.
You've got the biggest airport, Doug, so I'll leave that with you and I'll come back if you leave anything. Go ahead.
Well, I haven't had any direct conversations regarding that topic, and that's where we're at right now. But again, I just want to reiterate what I was saying before. We're in the process of lifting public health measures. We're doing it cautiously. We're doing it slowly. We're doing it responsibly. And that's how we're going to get out of this. And I'm just asking everyone to be united, not just here in Ontario, but across the country. This is how we're going to get out of it. You know, this has been painful for every single person over the last almost 2 years right now. You know, protocols changing, guidelines changing, going across the border, back and forth. But this is not the time to be divided, folks. I'll tell you, this is a time to stand up together and be united. We're that close from putting this behind us. And I can speak for my other premiers. We have the most united group of premiers I've ever seen, right across all the provinces and territories. We work so well together. As Premier Horgan said, we come from all different political stripes, but we have the common goal. Our common goal is to make sure we get through this as quickly as possible. We get the economy up and going, and let's just try to get back to our normal lives. And I'm just very grateful. We have the best 13 premiers I've ever worked with.
Premier Horgan?
Well, I'd just say, Richard, that we haven't, as Doug said, we haven't engaged on travel issues in the past 2 engagements with the federal government. I'll pick that up. I'll see what I can learn about any changes coming. We did talk about interprovincial issues and how we all steadfastly support the mobility of Canadians, the right to go from coast to coast to coast. We, of course, addressed that with our immediate neighbor in Alberta over the past 2 years. We don't believe that closing borders internally is a solution, but we have also been calling on the federal government in the early stages of the pandemic to monitor and manage our international borders. But as we come to this place of moving in the next number of weeks to potentially endemic rather than pandemic, we need to reimagine the tools at our disposal as citizens and as provinces and as a federal government. Is how do we maximize our ability to protect people, which is our obligation, but also to ensure that their liberties are intact and they can make choices for themselves. It's a fine balance, and we're all working together on how do we get there, and we'll continue to do that.
Premier Kenney, please go ahead.
Yeah, thank you. I would like to speak to this on behalf of Alberta. I think this was not on our agenda for the Council of the Federation this morning, but I do think there's a widespread recognition across the country amongst the provinces that we need to respond to, our response to COVID needs to change as the disease and the threat change. And with respect to travel, there are many jurisdictions around the world that have adopted more common sense travel protocols than we have now in place in Canada, recognizing the nature of the current nature of COVID-19 and Omicron. You know, for example, we have tens of millions of people between Canada and the United States with current Omicron infections. And so the notion that we can interrupt or reduce community transmission through very rigid travel protocols, I think is unrealistic. Professor, I think it's Shagla, Professor of Infectious Disease at McMaster University, had a really thoughtful opinion piece in the Globe and Mail on February the 1st, pointing out that these current travel restrictions are not meeting their intended their goal. So for Alberta's perspective, we would call for an end to the 72-hour pre-departure testing, the arrivals testing and self-isolation requirements, and to eliminate guidance for all children under 5 to quarantine, as well as the global travel advisory. We don't think these measures are effective in the current context. And let's not forget that there are there are two sectors of the Canadian economy still brutally hard hit from COVID, and those are travel and tourism. Hundreds and hundreds of thousands of Canadians whose livelihoods depend on those industries still being very significantly impaired. So I hope that the federal government is mindful of that as we move forward.
Thank you, Premier. Next question is from Jeremy Symes, Regina Leader-Post.
Hi, thanks for taking my question. It's for Premier Scott Moe. Premier, you said in September the choice to not get vaccinated was a reckless decision, and so that stance of yours has changed significantly. So with this new direction you've announced to remove proof of vaccination, benefiting unvaccinated people most, and it comes at a time when we're seeing these freedom rallies across the country and Regina tomorrow, along with allegations that there's divisions in the South Prairie caucus. I'm just wondering, it seems like you're placating these freedom rally protesters, and I'm just wondering why placate them.
Well, Jeremy, you got it. You have an awful lot of seems like and could have beens in your question. The fact of the matter is that Saskatchewan, and I don't doubt that all provinces ultimately are, always looking at the effectiveness of the measures that we have in place. I said this in a previous answer, and also looking at where we are with respect to adding measures and making additional measures available to, in our case, the people of Saskatchewan, but in my 12 colleagues placed people across Canada. In the last while, we have greatly enhanced the access to vaccines. That's something, if you look back a year or 15 months ago, we just simply didn't have anywhere in Canada. We have rapid tests either on the ground in our various communities across Canada, as well as or they're on their way, and they're ultimately a very effective tool in being able to identify and actually isolate COVID positive cases sooner rather than later. And our collective goal is to reduce the strain on our healthcare system, of which has been really highlighted the challenges that we have in our provincially delivered healthcare systems across Canada over the course of this COVID pandemic. Now, that being said, many of those challenges have been in that healthcare system for some period of time, and they've been in many cases, whether it be masked or, as John had said earlier, we've triaged our federal resources to ensure that we are providing the most relevant and needed healthcare services in our respective areas across Canada. That's why we have come together for a period of time today, and come together again today to highlight the opportunity that the federal government has to participate in being a full funding partner in delivering these provincially delivered, yes, healthcare services, but be a full funding partner in delivering those services to all Canadians. And one of the questions we talked about at this meeting and previous meetings is, what does an increase in the Canada Health Transfer actually mean to Canadians? And we're really at a fork in the road as we find our way out of COVID with respect to, is there going to be an increase coming from the federal government? And I would put forward there's an opportunity for them to really participate in this. But, what does that mean to many Canadians as we find our way through COVID? It means, increased access to mental health and addiction support right in their community. It means lower surgical wait times. It means ultimately, increased ICU capacity, increased hospital bed capacity. That comes about through hiring additional healthcare professionals across this nation, and that's the opportunity that the federal government has before them in participating as a full funding partner through the Canada Health Transfer with the provinces, so that we can ensure that capacity of healthcare is available to Canadians. That's what it means to a Canadian family, wherever you might live across this nation. And we say we have 13 willing partners on this call right now to work with the Prime Minister on that. If we take a different fork, where the federal government, let's say, does not participate in increasing the Canada Health Transfer, that different fork looks very differently. And we talked earlier to the challenges in Newfoundland, but ultimately that different path of not participating looks like a much less responsive healthcare system, not only in Newfoundland, but across the nation. And it does lead to provincial financial capacity being very, very strained in the out years. And I've had discussions with my finance minister as to, what does our healthcare budget look like in the out years as we try to provide this care to Canadians, and it's quite a challenging scenario. And that is the other path, is reduced responsiveness to providing the healthcare that Canadians expect right in their community, and higher provincial deficits. I would say unsustainable provincial deficits into the future. And so that opportunity is for the federal government is here today. They have 13 willing partners on this call to really work together to enhance the Canada Health Transfer and ultimately provide that opportunity for increased healthcare services for all Canadians.
Thank you, Premier. Next question is from Josefa Cameron, Signal Halifax.
Thank you. This question is for Premier Tim Houston. There is a major nurse and doctor shortage in Nova Scotia, especially in Cape Breton. Some Dalhousie nursing students have been asked to work in long-term care rather than completing their clinical practicum. How do you plan to mitigate this issue in Nova Scotia? Thank you.
Yeah, well, thanks for the question. It's an important question. I mean, the shortage of healthcare professionals, it's nurses, it's doctors, it's CCAs, it's right across the healthcare spectrum, and it's something that's experienced not just in Nova Scotia, but countrywide, really. So, I mean, look, what we've said in Nova Scotia is we've been asking the whole COVID thing. The uniqueness of COVID is that everybody has gone through this experience together, no matter where you live in the world. Really, we've all kind of been going through this for 2 years, and we've got through this by sticking together, by being united, and of course now we're seeing that everyone's kind of reaching its fill with COVID too at the same point in time. But we've asked people to step up, and there is a discussion in this province with nursing students. I put a call out for volunteers, retired healthcare professionals, anyone who could really step up and help. We've asked people to help out, and I've been kind of blown away really by how Nova Scotians have responded to that call and stepped up, because we all want to get through this. We all want to do our part. So we want nurses, nursing students, particularly those here in Nova Scotia, to see this as a place where they want to stay and live and work. So we don't want to be offside of them and frustrate them with things, but certainly we've asked them to step up and help in our long-term care facilities. We'll work through that with them to make sure we get to a place where everyone is kind of happy with what's happening. Our intention is not to diminish their education anywhere. Our intention is to add to their education, supplement their education with other practical experiences, but certainly also all part of the process of stepping up together and trying to get through this COVID mess that we're in. We'll get through it, and we'll focus on all kinds of other issues in healthcare. But and as we say, restrictions are easing. We are getting through it. The end is near. But I really appreciate how Nova Scotians of all from every corner of this province have stepped up to do their part when asked. I'm really, really happy about that. Thanks for the question.
Thank you, Premier. Our last question today is from Jerome Labbé, CBC Radio Canada.
Bonjour, ma question est pour le Premier ministre.
My question is for Premier Legault. Mr. Legault, it's been 2 years that you've been doing the same request to the federal. 2 years, you receive the same answer, meaning that Mr. Trudeau thinks that the pandemic is not the right moment to have this discussion. So I would like to know one thing. What is, according to you, that changed? What changed? Why do you think this time is the right time? Tell me about the context. Do you see in the next few weeks, next few months, a window of opportunity that we are not able to see ourselves?
Premier, you're on mute.
Donc, vous avez raison, ça fait 2 ans.
You're right. It's been 2 years that we've been doing the same request to the federal government without really having any result. At least long-term funding. Mr. Trudeau is saying that he will wait the end of the pandemic. But there are gestures that we have to make now. We started already, each in our provinces and territories. In Quebec, we talk about doing the system. We hired additional staff. So we try. But it's not a topic that is easy, honestly speaking, to explain to the population. And it is the population that in the end must, with us, support this request to give priority to health. Because if we take the example in Quebec, I said it a moment ago, the Quebecers sent 40% of their taxes to Ottawa, I think health is a priority, a big priority for Quebecers. So it's not acceptable that the federal government fund only 22%, but these are figures. It's not easy to explain. The field of competence is in the provinces and territories, but it was decided at the beginning when programs were launched of healthcare that it was going to be a 50-50 funding. Now it's 22-78. It's difficult to explain that. We hope that the pressure will be bigger and bigger to the federal government. If Quebec would be alone, it would be distressing. Now we are 13 out of 13 doing exactly the same request. So we hope that at some point the federal government will accept to meet with us and accept to bargain something on the long term with us.
Thank you, everyone across the country. I want to just reiterate, you have 13 people representing different regions, different political perspectives, and I was remiss in not saying, with respect to Carolyn and PJ in the Northwest Territories and Nunavut, consensus-based government, and we've greatly benefited from their approach to our discussions and deliberations that don't come from a partisan place, but come from a place of collaboration, which is how their governments operate every single day. And the last thing I'd like to say before I pass the microphone back is to remind everyone today is World Cancer Day. And in British Columbia, 85 families will hear that someone in their family has cancer. Another 85 tomorrow and the day after that. I appeal to everyone, if you feel there's something wrong, if you feel that you've got an issue that needs to be addressed, find a healthcare provider, get it checked out. Early detection means better outcomes. It's important to remember that each and every day. And again, I want to thank my colleagues for their collaboration. I want to thank the media for their patience through this first ever, I believe, virtual press conference from coast to coast to coast, every capital in the country being represented. We're going to keep doing this together until we get the outcomes that all Canadians expect from us. So thank you very much, and I'll pass it back to Lindsay.
That's all the time we have for today. I want to thank all the premiers and everyone else on the line for joining us. This concludes today's news conference.